Magandang araw sa inyong lahat. Good day to all. I am Dr. Carmencita Padilla, one of the proponents of the newborn screening program in the Philippines. Join me in uncovering the wonderful story of newborn screening in the Philippines. Together, let's zoom in on what makes NBS a comprehensive program for every Filipino here at Newborn Screening in Focus. To ensure that newborns are truly healthy, they must undergo newborn screening, a public health program that helps determine if a baby is born with one of the more than 20 congenital disorders. Its importance cannot be overemphasized. If any of the congenital disorders is left undetected and not managed immediately, it can lead to mental retardation and even death. It was integrated into the public health delivery system with the enactment of Republic Act 9288 or Newborn Screening Act of 2004. Now part of the PhilHealth's newborn care package, newborn screening is being offered in more than 7,000 hospitals and birthing centers nationwide. It has also saved thousands of children. This educational series is intended for health professionals who deliver services of the newborn screening program. Whether you are online or offline, this program aims to further enrich your knowledge on newborn screening and be able to apply the highest quality service to Filipinos, especially during challenging times. We will discuss the very process of newborn screening from the moment the baby is born and into the continuing care available for newborns found positive. We will also zero in on the features and management of each of the conditions included in the newborn screening panel. We will also interview patients as well as their parents. And in keeping up to the challenges, talk over how facilities and centers manage to give quality service despite the limits brought about by the COVID-19 pandemic. This program is the newest educational platform for our newborn screening coordinators. One in every 7,200 health facilities throughout the country. We also hope that this series will also benefit the health professionals, physicians, nurses, midwives, medtechs, nutritionists, as well as students in the health professions. So take a seat, get comfortable, as you're in for quite an adventure here at Newborn Screening in Focus.
Kaya dapat magpa-newborn screening.
Welcome to the second episode of Newborn Screening in Focus, where we will talk about the sample collection process, how samples are collected and handled in newborn screening. Sample collection is an integral part in the newborn screening process. It involves the collection of a small volume of blood via a simple heel prick in the newborns onto a special filter card or the so-called Guthrie card. In this episode, we will be tackling the proper way of collecting the dried blood spot sample, discuss the factors making these samples unsatisfactory, insufficient, and unfit, and also discuss ways on how to avoid these errors and facilitate timely and adequate newborn screening. Let us listen to our newborn screening sample collectors on their challenges on sample collection and how they address these challenges.
I started my newborn screening services way back 2004, and I was, I think, the first lying-in clinic here in Makati to have a menu of this newborn screening. And after my training, that was April, right after my training from the UPPGH in Manila, I started the following day of my newborn screening. During that time, I used to have about 30 deliveries in a month. And I started it with my package delivery. I included that in my delivery so that when the patients come, they will not refuse anymore.
We started last January 2010 pa, ma'am. 11 years na we're doing the newborn screening here in our hospital. Sa mga baby and treatment like the CH and the COH. Kasi yan ang importante. Kasi ang paano namin ang pag-orient namin dun sa mga mothers during prenatal, gina-lecture sila ng mga nurses namin. Actually, ako sa laboratory are only doing the collection and about the education and ang nurse na namin na in BS in charge.
Lahat ay nagpapa-newborn screening. Wala pong nakakaligtas na pasyente dito sa amin kasi ang ginagawa po namin, before sila mag-discharge, 24 hours after birth, doon na po kami kumukuha kaagad ng newborn screening para kung ang pasyente malayo man, coming from other towns, other barangay, nalalayuan, they will go home with the complete services with newborn screening po.
Mandatory sa hospital namin na every newborns, talagang i-newborn screening namin. Hindi sila makauwi na hindi maka-newborn. So, nag-strategy kami, nag-strategize ako, na i-train ko na lang yung mga kasama ko na mga medtech and laboratory aides so that makater namin lahat ng mga newborns namin.
During my training po, doon namin nalaman na ang newborn screening ay kailangan talagang gawin sa mga bagong panganak kasi makikita po natin paglabas ng baby, it's normal. Features niya is normal. Umiiyak siya, natutulog siya, dumedede siya. But we don't know na something is going on already for those babies na meron ng mga metabolic disorders.
We have the 1,200 newborns yearly ang makolek namin. Ang challenging part doon, actually ang baby walang problema. The parents na handling the baby kasi talagang normal na iiyak yung bata. Kaya sabi naman, pinapahawakan talaga namin sa ma'am, sa watcher or sa father. Kasi yan ang gusto ng mga dito, ng mga tao. So, ayan, ang challenges namin yung sabi na maawa daw sila sa baby.
Nung hindi pa po nagkakaroon tayo ng pandemic, nagkakaroon po kami ng mothers classes. So during mothers classes po, isa sa subject ng aming mga nanay ay ang newborn screening. Ini-introduce po namin plus nabibigyan po namin sila ng mga flyers na ganito. Ito, ganito. Galing po ito talaga sa NIH, no? Tumagan nito during mothers classes po, ina-explain po namin sa kanila bukod po sa ganun, meron pa akong partner pediatrician dito sa clinic who goes on everyday clinic. So, nagto-talk din po siya about newborn screening.
After 24 hours, dalhin doon ng watcher sa laboratory. Then, the watcher will bring the data of the baby. Ayun, then i-transfer namin ang data doon sa filter before namin sila i-collect. Then, i-log in namin sa logbook namin sa newborn screening logbook.
Nga po matagal na akong na-train noon pa, 2004 pa po yung training ko. Actually nga po, yung pag-prick namin sa baby, ang ginagamit namin is kamatis. Kasi di ba po yung kamatis talagang parang sakong na yan ng bata. So doon ako nag-training, doon ako natuto. And then kung mga kami in group with the Well family before, meron nung training ang mga midwives namin sa Well family na tinrain naman po ng mga tao sa UP. Doon po. Kaya lahat to kami certified kami dito na mag-prick ng baby.
Ang kahalagahan ng newborn screening sa pagtulong sa pagsakip sa buhay ng mga sanggol ay hindi lingid sa kaalaman ng mga tao sa iba't ibang parte ng mundo. Ang maayos na pagpapatupad ng programang ito ay nakasalalay sa kalidad ng mga nakokolektang newborn screening samples na naipadadala sa Newborn Screening Center. Upang maging garantisadong tama ang magiging resulta ng test, napaka-importante na tama at maayos ang pagsasagawa ng pagkolekta ng dugo mula sa mga sanggol. Sa maikling video na ito, ipapakita ang tamang paraan ng pagkolekta ng dugo mula sa mga sanggol. Sino-sino ang maaring magkolekta ng newborn screening sample? Ayon sa Section 7 ng Implementing Rules and Regulations ng Republic Act 9288 na kilala rin bilang Newborn Screening Act of 2004, ang mga maaari lamang na magkolekta ng newborn screening sample ay ang mga na-train na doctors, medical technologists, nurses at midwives. Saan ang tamang lugar upang magkolekta ng newborn screening sample? Bawat newborn screening facility ay marapat lamang na magkaroon ng malinis na kwarto o lugar na itinalaga para sa pagkolekta ng newborn screening sample. Kailan ang pinakamainam na oras upang magkolekta ng newborn screening sample? Ang inirerekomendang oras upang kuhanan ng dugo ang sanggol para sa newborn screening ay pagkaraan ng 24 na oras mula pagkasilang, maging ito man ay malusog, naka-antibiotics, may malubhang karamdaman, preterm o low birth weight. Gayunpaman, kung ang sanggol ay kinakailang masalinan ng dugo, dapat makolekta ang NBS sample nito bago masalinan. Sundin ang protocol sa blood transfusion para sa susunod na koleksyon. Saang parte ng sanggol kinukuha ang dugo na kailangan para sa newborn screening? Ang pinakamainam na parte ng sanggol na maaring kuhanan ng dugo para sa newborn screening ay ang sakong nito. Alinman sa dalawang paa ay maaring kuhanan ng dugo, ngunit kailangang siguraduhin na sa gilid ng sakong ito tutusukin upang hindi makatama ng buto ang lancet na gagamitin. Siguraduhin din na hindi namamaga o dati nang natusok ang paang kukuhanan ng dugo. Hindi rin dapat tusukin ang mga daliri sa paa ng sanggol. Bago isagawa ang pagkolekta ng newborn screening sample, kailangang ihanda ang mga sumusunod. Newborn screening filter card, non-powdered gloves, 70% isopropyl alcohol, dry and wet cotton balls, sterile lancet, micropore tape at drying rack. Isulat ang mga hinihinging impormasyon sa newborn screening filter card. Bawat isa sa mga ito ay importante lalo na sa interpretasyon ng mga resulta ng mga test. Iwasan na mahawakan ang absorbent na parte ng filter card kung saan ipapatak ang dugo ng sanggol. Siguraduhing tama at kumpleto ang mga detalyeng isusulat sa card. Siguraduhing tamang sanggol ang kukuhanan ng dugo. I-double check ang pangalan nito bago magkolekta ng sample. Maghugas ng kamay ng mabuti gamit ang tubig at sabon bago magkolekta ng newborn screening sample. Siguraduhing non-powdered ang gloves na isusuot upang maiwasan ang kontaminasyon ng sample na kokolektahin. Kung higit sa isang bata ang kukuhanan ng dugo, marapat lamang na maghugas ng kamay bago at pagkatapos ng bawat batang kokolektahan ng newborn screening sample at gumamit ng bagong guwantes sa bawat isa sa mga ito. Siguraduhing mas mababa ang paa ng sanggol kaysa sa kanyang ulo upang dumaloy ang dugo papunta sa ibabang parte ng katawan nito. Bago tusukin, marapat na painitin muna ng kaunti ang paa ng sanggol sa pamamagitan ng pagmasahe sa paa nito upang maging maganda ang sirkulasyon ng dugo sa parteng tutusukin at masigurong sapat ang dugong makukuha para sa newborn screening. Linisin ang parte na tutusukin gamit ang bulak at alcohol o sterile water swab. Punasan itong muli gamit naman ang tuyong bulak. Hayaang matuyo ang parteng tutusukin bago kumuha ng dugo. Tutusukin ang paa sa inirerekomendang parte ng 2 beses gamit lamang ang inirerekomendang feather lancet. Ibaon ang feather lancet sa gilid ng sakong ng sanggol hanggang sa stopper nito. Siguraduhing magkatabi ang 2 tusok upang magsama ang dugo at makabuo ng isang malaking patak ng dugo. Punasan ang unang patak ng dugo gamit ang tuyong bulak o malinis na gasa. Huwag pigain ng mariin ang paa ng sanggol sapagkat ito ay maaring magdulot ng pagkasira ng mga blood components o kontaminasyon ng newborn screening sample dahil sa tissue fluids na maaring mahalo rito. Matapos ang bawat pagpisil, hayaang dumaloy ang dugo mula sa itaas na parte ng katawan ng bata papunta sa kanyang paa sa pamamagitan ng marahang pag-release ng kamay mula sa pagbiga ng dugo. Hayaang dumaloy ang patak ng dugo patungo sa filter card. Siguraduhin isang malaking patak ng dugo lamang ang ilalagay bawat bilog. Huwag pagpatungin ang mga patak ng dugo. Sa harap na bahagi lamang ng filter card, maaaring magpatak ng dugo, ngunit siguraduhing sapat ito upang tumagos hanggang sa kabilang bahagi nito. Patuyuin ng pahalang o horizontal sa drying rack ang nakolektang newborn screening sample sa loob ng 4 na oras. Huwag ipagpatong-patong ang filter cards na ipinapatuyo. Huwag ding ibilad ang mga ito sa ilalim ng araw o gumamit ng ibang artipisyal na uri ng pagpapatuyo. Bago ipadala sa Newborn Screening Center ang filter card, siguraduhing tuyo na ang mga ito at kumpleto ang lahat ng impormasyong hinihingi sa filter card. Isulat sa transmittal form ang pangalan ng mga pasyente na maaari nang ipadala ang newborn screening sample. Ibalot sa malinis na papel ang newborn screening sample bago ipasok sa pouch. Ang newborn screening coordinator ang dapat magpasok ng sample sa pouch at hindi ang courier representative upang masigurong hindi makokontamina ito. Ipadala agad ang mga natuyo ng samples upang agad itong matest sa Newborn Screening Center. Kunin ang tracking number ng pouch na ipadadala sa courier upang makasigurong makakaabot sa Newborn Screening Center ang mga samples. Maaring ipadala ang mga newborn screening sample sa Air 21, LBC, DHL, A-Best at To Go. Hindi kailang magbayad para sa pagpapadala ng mga ito. Ang pinakamadalas na pagkakamali kaya ang mga samples ay mababa ang kalidad ay ang pagpapadala ng mga ito nang hindi pa lubusang natutuyo. Hindi maayos na pagpapatuyo ng parteng tutusukin matapos itong linisin ng alkohol, pagpiga ng mariin sa paa ng sanggol, o ang kontaminasyon na nahalo mula sa lotion o pulbos. Kung susundin lahat ng panuntunin sa video na ito, makakasiguro tayo na ang ipadadalang filter cards ay magiging maganda ang kalidad at tama ang resultang makukuha. Ating tandaan na ang buhay ng mga sanggol ay nakasalalay sa kalidad ng mga newborn screening samples na ating kokolektahin.
To enlighten us on the best practices of dried blood spot collection, we have invited 2 very special guests. Dr. Bernadette Halili Mendoza is the unit head of the Newborn Screening Center, Central Luzon, housed at the Angles University Foundation Medical Center. It serves all the hospitals and birthing centers in Central Luzon and the Cordillera Administrative Region. Our second panelist is Dr. Alma Andal, Unit Head of the Newborn Screening Center of Southern Luzon at the Daniel Mercado Medical Center, Tanawan, Batangas. NSCSL services all the hospitals of Region 4A, the Calabar Zone. Dr. Alma, Dr. Byrne, welcome to Newborn Screening in Focus. Let's start the conversation. Dr. Byrne, what is a dried blood spot?
A dried blood spot is actually the way that we collect our newborn. It's actually used in our newborn screening sample collection. It is used because it's actually very convenient, and it's just transported at room air in our laboratory. All of us, all of the newborn screening facilities makes use of dried blood spot in collecting our samples.
Okay, so can you just share who usually collects the sample in the newborn screening facilities?
The one who collects the samples in our newborn screening facility are the trained. These are only for the trained midwives, medtechs, physicians, and nurses.
Okay, so I know of some hospitals wherein it's actually the laboratory who collects the sample. So what you're saying is that so long as the person collecting the sample is trained, it is possible that it is shared by many in the health professions.
Yes, Doctora, as long as this trained personnel, trained staff, particularly the nurses, the midwives, the med techs, and also the physicians, they do collect. They're being trained to do the collection.
Okay, so when you're talking about the sample now, and as you said, it's the most convenient manner of collecting the sample. Would you say that it's how convenient is it now for a facility that's probably, you know, in an island community, or let's say in up in the mountain? Would this still be a sample that they will use, the dried blood spot?
Yes, Doctor, these dried blood spots are very convenient because aside from being easily transported to any laboratory, it has also the lowest risk of compromising the quality of the samples. Also, this dried blood spot, they do not require any collection of large blood volumes in order to be accurately analyzed. Plus, the advantage of this one, they can be stored for longer periods of time, so they can be useful, especially if there's a need for a retesting. If any retesting arises from that, we can actually get that. We can actually use them again.
Yes, because we actually have babies being born up in the mountain and the island communities. So let me ask now, Dr. Alma. So when is the best time to collect the sample from these babies? Is it uniform throughout the country?
Good afternoon, Dr. Padilla. Good afternoon, doctors. Actually, Dr., the best time to collect our DBS or the sample collection is immediately after 24 hours of life, because we are targeting the golden period of these babies. So we strongly advise the facilities to collect it immediately after 24 hours of life.
Okay, so thank you for that, Dr. Alma. I know the challenges in the Cordillera Autonomous Region, Dr. Byrne. Have you heard of challenges among our screeners and collectors when the baby is born up in the mountain? What are the usual challenges that they have given you?
The only challenges encountered within the Cordillera region is actually the transporting of the dried blood sample. From the center, sending it to from the facility, sending it to the center.
You know what? When I was reviewing the data for the longest time, the performance of the Cordillera Autonomous Region hits actually about 90% coverage of the babies. And I really have to congratulate, both the center and also the region for making this a reality. So I think, for our screeners who are watching right now, even those who are up in the mountains, they're able to perform newborn screening, and there is no excuse for that. Now, let's talk about the sample. How are these dried? Because when you put the blood into the filter paper, how are they dried before transport? Maybe Dr. Alma?
As to the drying of the sample, we advise the facilities to place the filter card or the filter card with the sample in a clean and in a clean area and air dried it up to 4 hours, minimum of 4 hours air drying so as not to have contamination. And we also advise that specific drying racks are to be used for the drying process.
Okay, so thank you for that, Dr. Alma. So what you're saying is that when the sample is taken, they've got to dry it for 4 hours before they put it in an envelope to be picked up by the courier service.
Yes.
I want to share with you, when I visited some remote areas in Africa, all related to newborn screening, they didn't have the racks. You know what they did? The workers actually used ordinary carton and put slits so that they could actually put the filter card. So my message actually to community is that if ever you don't have the traditional rack that we are talking about, you can always improvise. But the important thing is that you first dry it before sending the sample to the laboratory. So are all the samples good? I mean, maybe I can ask Dr. Bernal. I mean, can you, of course, in the video, we showed the correct way of collecting the sample. So maybe you can just walk through again the procedure and what is the proper way of getting a sample from the newborn baby, Dr. Bern?
First and foremost, Doctora, the newborn screening staff should prepare all the materials before collecting the sample. So what the newborn screening facility should be able to ready all the materials necessary, such as of course the filter card, and then the staff should ready like cottons. Of course, the sterile 3mm lancet should be also prepared, alcohol, wet and dry cotton, and of course the dry rack. And of course, aside from that, after preparing all the materials, the staff should be able to have clean and dry hands to be able to fill out the newborn screening filter card properly. Because filling up that filter card is very essential and very crucial for us in the laboratory. So the filter card has different parts. We have like the absorbent area, we have the demographic area for which all of the information necessary to get from the patients are there, and of course the detachable stub that is required for the fill health. And then when filling out that stub, we have to make sure that the staff should be able to write legibly, and we should be able to understand us from the center because we are encoding it. And we advise them to use block letters using a black or blue ball pen. We don't advise them to use gel pens or sign pens because they can actually smudge. The ink can actually smudge, and we advise them also to avoid erasures as much as possible, and to be able to fill out all of the required fields that is written in the filter card.
So thank you, Dr. Burr. So what you're saying is that even before you collect the sample, you need your materials to be ready.
Yes, we have to We have to prepare the materials so that when we collect, it would be easier for the staff to do the collection completely and accurately.
Yeah, and the important thing is that the card has been filled up already before you collect the sample, for the simple reason that if you've got many babies where you're going to collect a sample, you've got to make sure that the sample that you have really belongs to the baby where you're collecting the sample. So I think this is a message for our screeners that you cannot guess and say that I will write the name later. What is
Yes,
important, what we're hearing from Dr. Bernal is that you've got to prepare this, because before you collect the sample, you're going to check the tag of the baby and make sure that it actually refers to that particular baby. So yes, and then for our screeners, I think everybody knows that every time you order a filter card, it already has an accompanying lancet, because you cannot use all kinds of lancets. The ordinary lancet that's too long it's not appropriate for the babies. There's a specific size that we are using. So my question now to Dr. Alma is that, sometimes we have babies wherein you actually have other blood extractions. It doesn't have to be a heel break. I'm asking now, is it possible that we will just include the newborn screening in a blood extraction of that baby for other tests?
Yes, Dr. We can use also venous blood that is being used for other blood extractions of the baby, and then we will just get certain amount to be dropped on the filter cards.
Okay, so in other words, if you have a baby, probably at the ICU, which will have other blood extractions, then you can actually include newborn screening in the request. And as we heard from our guest, we want to do it really shortly after 24 hours. Now, let's go back to the heel prick. You know, it's for somebody who's not experienced, they say it's challenging. So, what will be your tips to our health professionals who are doing the newborn screening prick on how they can get a good drop of blood from the heel of the baby? I'll ask both of you. I'll start with Dr. Byrne, and then maybe we can just, explore some tips that we can share with the audience.
Okay, we usually advise them before getting the blood sample to prepare the baby, and we advise them to warm the heel or at least massage the foot down below to at least somehow increase the blood circulation in preparation for the pricking.
Okay, that's an excellent tip that we can give our audience now. No, merely massaging the heel of the heel of the baby can already increase, warm up that heel so that the drop from the heel is going to be much better. We want a good drop on the paper to make sure that we fill the circle. Okay, so that's really the message that we're talking about. Now, let's talk about, I know that there are times when we reject the sample. So I'd like to, just talk about when, the many times that we reject. Let's start with the contaminated sample, Dr. Bird. So what are the most common sources of contamination of a sample?
Actually, doctor, there are a lot. There are actually different types of contaminated samples that we get. These contaminated samples, we suspect them to be when they are exposed to contaminants because they can be because of layering when they put a blood spot like two drops of blood in one circle, or it can be because of oversaturation. Other types of contaminated samples can be because of serum rings, because they squeeze too hard. They squeeze too hard the heel of the baby. That's why interstitial fluid comes out. So it comes in the form of serum rings. Or sometimes contaminated samples can also be because of insect bites or any fungal or bacterial overgrowth. Those are the usual contaminated samples that we get.
So what I'm hearing from you is that if you warm the heel properly, you should get a good drop from the heel. And if ever you think that, you didn't get a good drop, you should not put it on the same side.
Same side.
Yes. Otherwise, you have the layering.
Yes.
Okay? And another point that you shared is that if you squeeze the heel too much, then you might be squeezing not the blood already,
but the interstitial fluid.
Yes. So you had additional tips there, making sure that there are no, you didn't use lotion or other things, just before the heel was pricked. So my question now to Dr. Alma now is that what if the drop of blood is small? And so what will they do? So Dr. Alma, I know that, some of the screeners tell us that they have difficulty getting one good blood drop to fill up a circle. So just in case they got a small drop of blood, how will they proceed with the collection, Dr. Alma?
Okay. If there are times that the collector wasn't able to fill in, or they were able just to collect a small amount of drop of blood in a particular circle, we advise the collector to proceed to the next circle to have it collected. There are times that it's really difficult to get a perfect shape of a specimen. So we advise the collector to collect from the other heel of the baby so as to avoid to be rejected for insufficient sample.
Okay, so let's make that clear. If you send a sample that is contaminated, from or overlayered, overlayering, that means you already had a blood spot and then you put in another drop to fill up the circle, that is going to be rejected. So what is important now is that you prepare the heel, warm it enough so that you get a good drop of blood. And as Dr. Alma said, if let's say you really just got a small drop of blood, then you go to the next circle. So I'd like to ask Dr. Burns now, why is it so important for us to fill in the 4 circles? Because we know for a fact that, we'll manage with one, but what is the purpose for filling up the other circles in the card?
Because we're testing, actually, doctor, we're testing actually 28 disorders. So we need at least to yield at least around 8 to 12 millimeter of blood disc. It's like the size is comparable to that of the bus ticket, because those the one that we punch are actually the one used in testing these different disorders. That's why we need enough, at least around 8 to 12 of blood discs for that. That's why we need the facility, the staff should be able to yield the 4 circles.
Okay, so in other words, if you don't give us enough blood sample in the card, then we will not be able to run the many tests. Now, it is possible that one spot will be used for many tests, but the point is you still need enough to be able to run. Would you like to explain to our screeners when you have to repeat the screen on that particular baby when there's an initial positive screen so that they understand?
Doctor, because sometimes if, let's say, those samples are, let's say, insufficient, there are times when the results need to be retested again, with what we call like running an AP sample, because we need to retest to confirm the previous test that we made use. That's why it's very important that we are able to get one. And if, let's say, those samples are not insufficient, then there's a need to do a retesting or a repeat. So the purpose of testing it, the purpose of us getting the result is actually delayed. So it's kind of hard if we do a repeat sample, because it delays the process. It delays the detection of any disorders from the newborn.
Okay, so I mean, that's very clear. There are many reasons why we are requesting to have those 4 circles to be filled up. Aside from the initial test, Dr. Burns is telling us that sometimes they have to do the retest even before the recall of the patient. So if you don't give us enough, then we will ask for a recall of the patient, and we know how difficult it is to recall a patient for another sample. Now, are there any other reasons for saying that the sample is unfit? I'll ask Dr. Alma. So aside from contaminated, insufficient blood, are there any other types of samples that you would deem to be, or with a circle, you said, meron circle siya kanina. So the 3, aside from that, what else are unfit?
Actually, our samples that are categorized as unfit are, as mentioned earlier, it's contaminated, insufficient, and outdated filter cards. Outdated filter cards are expired filter cards that we advise not to be used for testing. And then other categories would fall under the unsatisfactory samples.
Okay, so let's talk about expired cards. There's no reason for you to have expired cards, but if ever you do have expired cards, you have to have them replaced. Contact the center so that they can be replaced. Now, we talked about contaminated samples, we talked about unfit samples, we talked about the many forms that they don't look normal, we talked about drying the sample. So are there any other things that you'd like to share with the screeners in the audience so that the sample that they will submit to you it's of good quality? I'll start with Dr. Byrne.
Yes, Doctora. We actually advise the facility we wanted them to have a good collection, a quality sample, because that's our purpose, is to detect and to save babies from mental retardation. So we advise them to prepare the filter card properly, right? To fill out the filter card properly, completely, accurately, and legibly. and at the same time to collect a proper sample from the baby so as not to delay any process, so as not to delay actually the screening for our newborn babies.
What about Dr. Alma?
In addition to what Dr. Burns have mentioned, upon drying, we also have to ensure proper drying of the specimen. So we should take note that it should be at least 4 hours upon collection before we pack it and send it to the bio-courier. And we also advise these facilities not to do batching. So even if there's only one specimen collected, it is very important that you call immediately the courier for it to be sent to the NSC or to the center.
Dr. Alma, thank you for reminding us about the batching of samples. Do you want to let our screeners know that even if you have only one sample from a birthing hospital, from a birthing center or a hospital, that sample has to be picked up because it has to arrive at the lab at the soonest possible time so that we can make a prompt diagnosis if ever the baby is affected. So aside from drying the uncontaminated, have we covered all items, Dr. Byrne, Dr. Alma, as far as the sample collection is concerned? So far,
I think the it was all covered.
Yes. So so thank you. So this method is actually happening all over the country. So when we say that 7,000 hospitals are actually performing exactly the same method for newborn screening, it means that the standards have been placed, and that the reminders are given to you not only by your newborn screening center but also by the Department of Health. Now, I would like to stress to the community that we are in partnership with the Centers for Health Development. All our regional offices actually have a newborn screening coordinator, and they actually monitor the hospitals if ever there is an unusual increase in terms of contaminated sample. The collection of the good sample is part of the big picture of newborn screening, and with that, our guests have been able to explain that. So thank you. So just some parting words for our viewers. Let me start with Dr. Alma. Dr. Alma, parting words.
Since our discussion involved on proper collection and making sure that we are able to have quality samples, I guess we should remember that having quality samples will not delay any screening, will not delay any intervention or medical intervention. And the newborn screening program is a comprehensive one because it doesn't just cover screening, but also we make sure that the babies are being screened and treated at the right time. And seeing these babies grow and living a normal life, then we can say that we have truly saved them.
Okay, thank you, Dr. Alma. Dr. Byrne, final words?
Yes, Dr. We want you to always remember that a filter card is not just a piece of paper. We have to know that every filter card is worth a life. That's why we need to completely, accurately fill out those filter cards. And we remember that we can always replace these filter cards, but we can never replace the lives. And most importantly, timely is very important. The timing is very important because we want to have that vision and mission of us saving babies from mental retardation and of course death. Thank you very much.
Well, thank you, Dr. Burns, and thank you, Dr. Alma.
Kaya dapat magpa-newborn screening.
Thank you very much to our guests today, Dr. Burns and Dr. Alma. I hope that with our discussion, our frontliners in the DBS collection can apply the best practices that you shared. To our virtual audience, please send us your comments, questions, or list of topics that you want us to cover in our succeeding episodes. Email us at info@newbornscreening.ph, or you may tweet us at newbornscreenph and also include the hashtag ENBSPH. Before we end, I want to again take this opportunity to present to you the new addition to our tools in learning, our ENBS mobile app. The ENBS mobile app is a one-stop hub for all NBS health workers on everything they need to know about newborn screening. It also features a rewards program that our health workers can use to earn points and use it to claim shop vouchers with our partners. If you have already downloaded the app, answer the quiz and we will send to your inbox to earn those points. We continue to improve our services as deemed necessary by the emerging challenges through an open dialogue about our experiences in newborn screening. It is our hope that through this video series, this program, we extend the sharing of knowledge with greater reach, empower our frontliners, improve connectivity with the newborn screening coordinators, and most importantly, provide unparalleled service to every family. For our next episode, we will discuss different scenarios which may affect newborn screening results. This and more here in Newborn Screening in Focus. Nothing is more precious than seeing a child grow healthy and normal. Let's realize this through newborn screening. Newborn screening is a gift of life.
Mula sa sinapupunan, 9 na buwan ka naming inalagaan, at ngayong nandito ka na, di ka namin pababayaan. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, newborn screening. Love na love ka namin, kaya ito gagawin. Para sa kalusugan mo, dapat natin tong sundin. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening.
Napakadali ng process na magpa-NBS. Ilang patak ng dugo ang kailangan para magawa ang test. Makalipas ang 24 oras, pag si baby lumabas, gawin natin ng NBS, alin sunod sa batas.
Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Oh, aming baby, isa kang blessing, kaya dapat magpa-newborn screening. Newborn screening. Newborn screening. Oh, aming baby, newborn screening. Para sa iyo rin to, sa kalusugan